Good evening, guys. My name's Emily Adkins, and I'm currently enrolled in the Addiction Studies program at Mount West. And I'm also an employee of a local drug treatment center that treats adults age 18 and older. And today what I'm going to be going over is something that I think is really impacting our community, and it's something that doesn't get talked about as much. So what I'm going to be going over is adolescent substance abuse. I'd like to talk about some of the statistics and underlying causes of the problem. And I'm also going to touch on the mental health aspects of it and the cause and effect of that. And another thing that I'd like to touch on is the COVID-19 epidemic and sort of how that had an impact on the growing fentanyl crisis that we're now seeing. And then lastly, I'm going to go over some of the treatments and interventions that some other areas have implemented and have been found effective. So, to provide a little context, since 1999, overdose deaths among people aged 15 to 24 have increased by 500%. And in West Virginia, which was a state hit particularly hard, there are about 23,000 high school students that reported using substances in 2020. According to the National Centers on Drug Abuse, high school students in West Virginia are also 5.43% more likely to use substances than other places in the United States. So what these numbers are is they're more than statistics. These numbers represent real people, families, communities all across the state that are trying to figure out how to deal with this problem. So first, we're going to start with some of the causes of substance abuse in young people. And one of the primary causes is mental health. According to Elizabeth Hawkins, who wrote an article called A Tale of Two Systems, nearly 50% of adolescents with substance use disorder also suffer from a mental health disorder. So then comes up the question, which came first? Did substance use cause the mental health disorder? Or did the mental health disorder cause substance use in order to cope with it? So often conditions like anxiety, depression, trauma, all of these things precede drug use, and they serve as a trigger for self-medication for people that don't know how to handle it any other way. And beyond mental health, substance use also affects their social competence, their behavior, their peer relationships, and often these challenges cause a decline in their academic performance. They isolate. Their mental health begins to get worse. And so it just starts this dangerous cycle over and over. Another thing that currently we're dealing with is the fentanyl epidemic. The COVID-19 pandemic started, it added a lot of new complications to this problem. While substance use did decline among teens during that time, mortality and morbidity rates actually increased due to the deadly effects of fentanyl. Now, a key reason is that there were a lot less restrictions. Things were, easier to get in and out of the country. And just the smallest amount of fentanyl is enough to cause someone to overdose. So on the positive side of this, though, there are a couple things the pandemic caused that could prove to be beneficial and have shown to be beneficial. And that is the access to telehealth. Now, what this does is it helps people that are in rural areas that may not have access to transportation or may not have a facility close enough to them that they can get to. Those telehealth programs provide doctors, therapists, counselors that are able to provide care over the internet, which is a great thing. One problem with that, though, is for teens and young adults, there are not really any facilities in West Virginia. And if you did get into a facility, transportation is likely going to be a very long distance. So that's going to make it difficult for many people. So another major influence in youth substance abuse is exposure to media. And I know that may not seem like a big thing, but it really does have a huge impact on young minds. Patrick Herbert and his colleagues had done research that showed that adolescents that are frequently exposed to substance use through media, as well as other risky behaviors, what they do is they normalize those behaviors, which can ultimately lead to long-term consequences, including adult substance dependency. So prevention strategies are what are going to be essential in maintaining this, preventing it, treating it, and trying to get a handle on it to hopefully lower these statistics. Some of these include family-based programs, community-based, as well as school-based. Among these, school-based interventions are usually the most effective, especially for students with limited access to any kind of external care or that have poor family environments. So some of these programs could include training teachers and counselors to be more aware of signs and symptoms of the behaviors that could be an indicator that a teen is using drugs. Another thing is providing more on-campus mental health services so that these kids have access to mental health care in order to understand what's going on with their mental health and maybe find alternatives and other coping mechanisms and tools that they would be able to use other than substances. And the third thing is being able to deliver educational programs that promote resilience and healthy decision making. That's very important. Some kids, like I said, don't come from a great family environment. Their parents may be addicted to substances as well. So it's very, very crucial for communities to provide those resources that children may not have at home. So another thing I'd like to go over in my conclusion about substance abuse is that it's not just a personal issue. It's not just an issue for poor people. It's not an issue for any particular race or ethnicity or religious background or financial background. It is a public health crisis that is affecting everybody across the board, rich, poor, black, white. It doesn't matter where you're from. It is possible that you or a family member could be affected by it. So by implementing early prevention, a lot of education and support and resources, especially in schools, we can give young people support that will hopefully help them before it's too late. Thank you.